So I've got a diabetic patient here who's also got rheumatoid arthritis, and they've got this sort of lesion that's painful underneath their foot. So they've still got enough sensation to feel pain, but I'm suspicious that they're not feeling the total amount of pain from this. So it looks like there's been some bleeding in there as well, and so we're really suspicious that this one might be an ulceration under there and not a corn. So it may have started off as a corn and then led to tissue breakdown underneath. So as usual, we go here and just remove as much of the callus as we can just while we have a look at this. And you can actually see that just in that last cut there, that it's opened up and you can see there's a cavity under that. So it looks like it's ulcerating. So now it's really important when we've got an ulcer like this to actually check what the edges look like. We don't want there to be undermined edges because that's a sign that the ulcer is not healing and that we need to go further. So we usually get a little bit of blood when we debride ulcers like this. So if you don't like blood, it's probably the time to go away from this video. So basically what we're doing is just removing all of the non-viable, all the dead skin, dead tissue, and trying to get the edges of the ulceration or the lesion back to a shape that will actually heal from the bottom to top, which can be a little bit more difficult in these diabetic patients. So the main risk of this type of ulceration and infection in a diabetic patient is the risk of the infection spreading into the bones where it's very difficult to get rid of, and that would usually lead to an amputation depending on the status of the patient. So you can see we're going in there, you can see the blood's really nice and red, so it means it's well oxygenated. So we keep going in. This is not particularly painful for this patient at this point, so we're really suspicious that this might be a diabetic neuropathic ulcer. We'll go in there and just continue cleaning it up. Make sure we dress it all up properly so it's because of course the foot being on the ground will pick up any dirt, but that's how we treat a diabetic ulcer.